One.
Okay. What am I supposed to do? I want to say good afternoon. I'm about to start the Health and Human Services and Policy and Legislation Committee meeting at 6 o'clock. Okay, meeting called to order. So I'm going to start off by saying my name is Delornina Morin. I am the committee chair for Policy and Legislation. We are having a combined meeting today to discuss sort of the policy and legislation and solutions for some of the drug epidemics here in the hub. In particular, we have a huge drug issue, also syringe issues in St. Mary's Park. So because that issue is both health and human services and policy, we decided to have a joint meeting so both committees can overlap. I do want to say as the agenda shows, the On Point, which does multiple things. They do syringe pickup already in the Bronx, but they also are a safe injection site in Manhattan, one in East Harlem and one in Washington Heights. They'll be giving a brief presentation today. But let's start off by just quickly doing introduction. I don't think we currently have any new members, but just in case, it's the first meeting of the community board season. So we're just going to go around and do introductions. We're going to go this way. And so, as I stated, my name is Delornina Morin, and I'm the committee chair for Policy and Legislation.
Good evening, everyone. My name is Christine Licata, and I'm an arts and health consultant here in the Bronx.
Hi, I am Guatuque Ininaru, and my colonial name is Ramona. I run a national organization to save public housing from privatization and demolition.
Good afternoon. My name is Terrell Jones. I'm advocacy and community engagement manager at On Point NYC.
Hi, everybody. My name is Thomas Blazik. I'm the field services manager for the Bronx for On Point NYC.
Hi, I'm Marina Samuel. I'm a reporter for the Mott Haven Herald and a student at the QVJ School.
Oh, nice.
I'm Sam Murphy, and I'm also a reporter with the Mott Haven Herald and a student at QVJ School.
Hi, good evening, everyone. My name is Claudia Rahman. I'm a community board member, and I work as an administrative assistant at Philanthropy.
My name is Karen Chamorro. I'm a community manager at Harlem Hospital. I'm a member of the community board.
Clarissa Layeto. I am the board chair of Community Board 1.
Hi, good evening. Leonardo Cuola. I'm the Bronx director for the Mayor's Office, Community Affairs Unit.
Hello, everyone. Stephen Palmer's community coordinator for Bronx Community Board.
Hi, Erin Marr for the Mott Haven Herald and also a community journalist.
Hi, everyone. My name is Jose Quintana. I'm with the New York City Department of Health and Bronx Neighborhood Health Action Center.
I'm Brandon Munoz, Director of Outreach and Public Safety, Assistant Director of Public Safety and Sewer Litter in the Bronx, in the whole, wherever we cover, I'm there. Yeah.
Hi, how you doing? My name is William Morero, harm reduction specialist at On Point NYC.
Good evening, Anthony Jordan, District Manager to the board. I want to remind everybody that our meeting is being broadcast on our YouTube channel, Bronx City 1. Please make sure you vibrate or shut down your devices so that we can not disturb it, and please speak elevatedly so that our recording devices can pick up everything else. Thank you, Madam Chair.
Okay, so just general goals. This is the first meeting, as I stated. One of our biggest goals this year is trying to come up with solutions and policies to address some of the drug issues here in the South Bronx in the Community Board 1. Primarily, we earlier today, the bid director of Third Avenue did a tour of like Robert Clemente Square and just like that area around 149 Third Avenue to talk about some of the drug use syringe issues that are happening in that area. It's an ongoing topic, and we hope to, of course, advocate and assist in some solutions. We have been discussing a possibility of a safe injection location here in the Bronx, potentially. We do understand that the Bronx has what we feel like is an oversaturation of Suboxone drug treatment clinics, and we think some of that contributes to the high concentration of drug usage and substance abuse, individual substance abuse in that area. But we are interested in what they're doing in On Point. There's an On Point location, you guys, in East Harlem and Washington Heights. And so we'd love to hear from them. I'm not sure if we have enough, but they did pronounce these packages. I think I have 2 left. I'm sorry, I do have 2 left if someone doesn't have one. And you guys can begin your presentation. I don't know how you guys plan to start.
Quick discussion, a little bit about the history of how we got where we are. So, like I said, my name is Terrell Jones. I've been part of the birth of the Opioid Prevention Center when we started advocating this like 12 years ago. Through the collaboration with Drug Policy Alliance, both in New York Academy of Medicine, there was discussion about opening up an opioid prevention center in the United States. By looking at the data from all of the opioid prevention centers across C, we looked at how cost-effective it was, how it would help the marginalized community, and how it would help people who use drugs and reduce the number of fatal opioid deaths. The reason why we wanted to address the issue because we were seeing this high number of overdoses increasing in our neighborhood each year. Those numbers kept going up. And there was no real way to address this. Naloxone is not the answer to overdoses. So we decided to start going to City Hall, going up to Albany, to start now advocating for these centers to be open in our community. It took us 7 years to get one open. And that was open because of, as de Blasio was leaving office, he signed an executive order to open up 2 pilot programs, one in East Harlem and one in Washington Heights. They're no longer pilot programs anymore. They're functioning programs that are running right now. We gave out these handouts so individuals could take a look at them, and you can ask us questions what you would like to hear, you know what I'm saying? But this is our 1-year plan, packet that we gave out after 1 year of individuals researching and seeing the work that we've done. When we talk about overdose deaths, in our facility, there had never been anyone who died of overdose. Why? Because of the simple fact that because we provide a safe environment for individuals to come in. And one of the things that we definitely want to do at this meeting here is invite you individuals to come to a tour one day and take a look at the facility. Because this is one of the things that we do to dismiss the myth that everyone talk about. You will not walk in there and see people chaotically using drugs. No, you will not see that. You see individuals sitting down waiting for them to be called to go into the opioid prevention center. They have to go through a screening. There's certain information that we need for them to go back there, and then they go back there, get their clean supply, and they use back there in a safe environment. If there is an overdose, one of the first things that we do is we use oxygen and agitation. We don't run straight to naloxone. We don't want to put nobody in the withdrawal. And by putting someone in the withdrawal through naloxone, that only means that the person is going to be agitated and angry because they're not feeling the effects of the opiates. So they may want to run back out and use opiates again and can't feel it. And when the naloxone wears off, they go back into another overdose. So if we have to give an individual naloxone, we give them 1 millimeter of naloxone, not 4 millimeters. Why? Because this knocks the receptors off and just lets them feel enough of the heroin where they're not overdosing. But that's just one of the programs that we have here. We have one-stop shopping, as we try to call it. Individuals come in and receive an array of services. And I'm going to let Tom and my other colleagues speak on that.
I'm sorry, where did you say the facility was?
East Harlem, 126th Street between Lexington and Park Avenue.
The one in the Heights is the corner of Amsterdam and 180th.
And then also one of the things we want to remind individuals that you cannot replicate what we have. Your overdose prevention center will look much different from ours because of your location. That has been proven to all the overdose prevention centers that's overseas. Nothing looks the same, you know what I'm saying? You have to look at what the demographics is, the drug use, the rituals of people who use drugs, you know what I'm saying? And also too, the ethnicity of the people that's using the drugs there, you know what I'm saying? So everything looks different, you know what I'm saying?
And the drugs itself.
Right. So we've done drug checking up here where we tested some of the drugs up here. You guys have a high rate of xylazine, fentanyl in this area here. Very high.
What's the first drug you said?
Fentanyl. Fentanyl and xylazine. Xylazine is an animal tranquilizer. It is not meant for human consumption. This is when you see all those individuals who have all those sores on there, on their body. Yeah. This is because of xylazine. The sore does not have to appear where they inject at or sniff at. It can appear on any part of the body. And in order for individuals to have the sore stop, they must stop using the drugs. If they continue to use the drugs, it only exacerbates the soreness, the sore. These sores can lead to amputation, which they have to a lot of people.
Can you repeat the name of it?
Xylazine.
Xylazine.
Fentanyl is 100 times stronger than heroin. This is another thing that people are finding in the drug system. Supply, and also we're starting to see something called carfentanil, which is 150 times stronger than fentanyl. So if an individual are ingesting these drugs right here, sometimes this can cause a fatal overdose. As soon as the individual uses it, they can die from an overdose because of the potency of the drugs here. As I stated, the Bronx has probably been known as the dumping ground for all new adulterants that's in the drugs. If we test drugs in the Bronx compared to other portions of the state, they're going to have all the adults that we have in our drug system here, our drug supply here. So I want Tom to talk about, the services that we provide at Home Point NYC.
Thank you so much for having us here this evening. To address some of our concerns that we face on a daily basis. The xylazine issue is one that we're working with our participants every day. We're teaching them how to stay safer. We're teaching individuals how to test their substances. We are cleaning and dressing the wounds that unfortunately so many of our participants are now having to deal with. So we're really bringing the services to them. And we're here every day. I'm on 149th every day. We go to St. Mary's, we go to AutoZone, we go to Brook, Melrose. We're seeing, I think we all know about the Melrose.
When you say you go, is it to pick up, collect syringe? What do you guys?
That's part of what we do. So
we're gonna get into all that here.
So when we have our locations that are brought to our attention from, we call them hotspots. These are locations that the community alerts us to and that the participants tell us that, and then we drive around, we find out where the trends are, where the areas that are most active, and then we work that into our schedule. So when we do go to a location, we're going to sweep for any discarded syringe litter that we see on the street. We collect that and we dispose of that. We have a service that we work with and we dispose of everything we collected. Just to give you an idea of what we're working with, in August alone, we collected over 7,600 hazardous waste units from the Bronx.
How does that compare to the East Harlem and Washington Heights? Do you know?
Washington Heights is up there. East Harlem is not as bad as the Bronx, but
East Harlem, as people may not know, we have more stimulant users in East Harlem.
Yeah.
More what?
Stimulant users. People who use
Cocaine,
cocaine and stuff
crack,
like that. Than injection drug use in East Harlem. Yeah, I'm sorry. So what we just gave y'all was our 1-800 numbers on there. So people will call us if there's public drug use or there's discarded syringes They would call our hotline number. The dispatcher would get in touch with either Tom or someone in East Harlem or Washington Heights, let them know the location of the syringes, and we would have a team probably there within 45 minutes to an hour. Now, why we say 45 minutes to an hour? Because we have so much area to cover. You know what I'm saying? We spread thin. Yes,
Hi, my name is Joanne. Joanne Tate, I apologize for becoming for late from VNet's help. I just have a few questions before you go on because you're moving away from this. Are you governed by OMH, Oasis, or SAMHSA? Or are you, I mean, you said you don't use naloxone and that?
Okay, so we are governed by the Department of Health.
Oh, okay.
We do get funding from Oasis, but
Right.
under the guidelines and policies and structures that we work under, it's from the Department of Health.
Right. So you have training in naloxone. You
All
do
right, so
use it.
yes, we go through massive training
Right, so
all
I
the
just
time.
was surprised you said you didn't. Your safe space for people who actively use drugs. I'm just wondering who oversees that and what does that look like? And are they able to come in and out? Is it appointments or are they encouraged in any way? Because in a way, I don't.
All right, so our overdose prevention centers are, like we said, we have one in Washington Heights,
Mm-hmm.
we have one in East Harlem. Run entirely different, two different models.
Mm-hmm.
So the one in Washington Heights is, we do it because it's cost, we saw the cost effective of it. So Washington Heights is ran strictly by trained peers. You know what I'm saying? We do have medical personnel up there, but not that many.
Okay.
The East Harlem site has all the services. We have medical help, we have clinicians, doctors, nurses there. You know what I'm saying? So they help oversee those. But the Opioid Prevention Center is run by staff, trained individuals who have a background, nursing background, any type of background in the medical field. Those are the individuals that work there.
So sorry to interrupt. Just two things. One, I just want to make sure we introduce all the new people. We don't know.
Oh, I'm sorry.
We don't know, and you're not the only person who came in late. So people who came in late, I do want them to be introduced, and then I want to reserve questions to the end. So therefore, everyone here who wants to say something gets to say something. So therefore, your question may be answered by the rest of the presenters from On Point.
Thank you.
Sorry to
No,
abruptly
thank you. It's
get
okay.
in there. I'm sorry. Okay, so introduction. Tell us your name.
Oh, I'm sorry. Joanne Tate from VNS Health.
Okay. Yes, you, Whitney.
Whitney Williams.
Herman, you want to introduce yourself?
Yeah, I'm been former board member. I'm a former member of school board also.
Okay.
And that time, you read the position.
Okay, and there's some few people over here. I'm sorry.
I am Nelson Gonzalez, Bronx Mobile. I'm co-founder of Bronx Mobile. We provide the same services On Point does. We're located here in the North Bronx, Webster and 197. We cover Washington Heights as well as North Bronx to Hunts Point.
Okay, thank you so much.
Alexis Del Rio. I used to live here for a couple of years, and I moved to Fordham, and I am also a co-founder of Bronx Mobile. So we do give services all from north to south of Grand Concourse, basically. So we go all the way up we're there, and all the way down over here. Also,
Thank you so much for attending the meeting. Okay, I don't know who's next and speaking On Point, but you guys, back to you guys.
So, about the services we provide, all services.
Right, so, when we come to a location that we know about, that we hear about from the community, we develop relationships with the participants, and in doing so part of our work involves cleaning up the hazardous waste. That's part of it. A part involves syringe exchange. Some other part involves the overdose education. As I spoke earlier, we work a lot with the wound care. We come out with, we do a lot of transportation where we find individuals that need medical assistance, and we transport them to our facilities, either in Harlem or Washington Heights. We try to encourage them from the Bronx to come to the Overdose Prevention Center. We do provide transportation. So we're now integrating another vehicle into our Bronx outreach team, which is helping a lot with transportation. When we bring many participants to the OPC, we find that 75% of those that do come to the Overdose Prevention Center also receive wraparound services. So we're also talking about getting people into detox, okay, into treatment, dealing with medical issues that they otherwise might not have been able to deal with. And so these are some of the services.
So we have a volunteer program, mental health services, drop-in center, surrender exchange services, shower, laundry, medical services, public safety and outreach, drug checking, holistics, case management, food and nutrition, hazardous waste management.
Laundry, everything.
Yeah. Respite center, shower, yes.
So we let like the folks that are using the public, we let them know that they could come there, but the problem is getting them there because it's so far.
Yeah.
But we do our best to, like Tom said, it's like, encourage folks to get over there because we understand it's, we got to look at it both ways from the community side and their side. We're all sharing this community together. But yeah, we do our best to try to get folks into the OPC because we know in the streets when they're alone they can die and God knows what else. But coming over there, like you said, you get the wraparound services. You go in there, choose the OPC. Next thing you know, you're seeing a doctor and you're feeling kind of good about it. You're like, hey, maybe maybe I could go into treatment today. Like it's also the kind of state of mind that we catch folks in. I'll let Tom continue.
And I think the most important thing that I want people to understand is how we treat people, how we talk to people. We have one of the most unique teams put together, where we talk to individuals, we have to show love to people. Make individuals feel like they're a human being again, because so many feel outcast. They feel like aliens, they don't belong here, you know what I'm saying? I know that's how I felt when I was out there 21 years ago. When I was using, how people in my own community ostracized me. They spit on me. They threw stuff on me. They told me I'd never amount to be anything. And the worst thing of all is pointing to me with their child and say, never be like that again. Don't be like that person. Making me feel so bad that only thing I could do was use drugs to mask those feelings I was going through. And this is what a lot of individuals go through, those feelings there, but also addressing the trauma that people are going through in their lives. When we sit back and hear stories of incest, young ladies being raped on the street, the violence, generational violence that people go through. You know what I'm saying? No one sits down and asks the person, how are you doing, what you've been through, how can we help you? You know what I'm saying? And we're always telling people what they need to do. We don't do that at On Point. Our first question is, how can we help you? What can we do for you? We make it client-centered, you know what I'm saying? Bring a person in, have something to eat, see a case manager, and make them feel comfortable like they're a person again, you know what I'm saying? And this is why we have been so successful in the work that we do. Like you said, if you look through the package, you look at our numbers, you'll see our numbers have increased tenfold since we put all these programs in place. Another thing right now is that the possibility of we may have to be looking for more funding, because right now, as Tom just stated, we have 2 vehicles now in the Bronx. Why? Because people have been calling our hotline number or requesting for our services in their area. Mm-hmm. We just started going up to the Landberg houses by the Bronx Zoo because there was a number of fatal overdoses in the hallways. The individuals came and spoke to us about, we need the system, we need help. So now we dispatch a team there every Wednesday morning to combat that, you know what I'm saying? But there's so many pockets in the Bronx. We come over here to Roberto Clemente on Wednesday morning before we go to Lambert. We see the devastation. We see what goes on there. We clean the church, from the church, everything, that whole area. We talk to individuals about coming to On Point. May get 1 or 2, they may come, but the rest feel that they're going to miss something in their neighborhood, or they're trying to scrounge up money to get some drugs.
So, first of all, thank you so much for this presentation. I just want to kind of keep the little things moving. I want people to know that I gave you guys a lot of paper, especially for my board members. It's important that you understand a few things. This conversation will happen again next month, but I want you guys to know that We had an intern this summer who did a full report up on point, based on a few reports, and that is on here, and that's 10 pages. Also talking about funding, which we understand is a huge issue for not only On Point Bronx mobiles here. There's a thing, it looks like one article, but it's really 3 article staple. We have opioid settlement money that Hochul has stated she will not use for harm reduction, and that is a huge issue. She's very firm on that. And there's an article on here that discusses that. Jesus, that always scares me. There's an article from the mayor who committed $50 million to treatment. There's some questions about where that money's going, how that money's going, given the fact that opioid settlement money cannot come to this at this point. So we're really going to try to be as big advocates this year around this issue for funding purposes. And I do want to say that there's a report written in there about On Point from our intern in a more like independent, objective way. I am now going to open it up for some questions, and be mindful, whatever they don't have answered right now. The policy team is coming next month on a Thursday at the policy. At my meeting. My meetings are on Thursdays. And it will also be a joint health and human services meeting. It'll just follow on a Thursday next month. And then St. Anne's Harm Reduction, did I get the name right? They will also be here as well, so that we can hear from, the other organizations that are working in the Bronx, and we can, again, be collaborative and creative about solutions. So just so you guys know some of the trajectory for this year regarding this issue. Okay, questions. Go ahead, Ramona.
How does the presence of the 2 spaces that currently exist affect the visibility of drug use, right? So there's like a huge perception that 149th is what it is. And once you came into East 126 and West 180th Street, was there a visible change that the community could know? And then if you don't have like clear stuff now, that's fine. And then the second one is, how many square feet do you have at each site? Because I think you said the East Harlem one seems to have more services. So if you guys could get us information on like how big the space is, if it's going to require like a holistic approach.
Okay, so the drug use in the 10-block radius of On Point East Harlem has decreased. Syringe litter has decreased. I want people to really understand what I'm about to say. It is not going to reduce everything.
Yeah.
Why I say that? Because through the years that we had this center open and the work and information that we have collected, we found out everybody's not going to use OPC. Why? We have chronic homeless people that's been homeless over 10 years, refuse to step inside our doors because they're so used of the ritual that they use when using drugs. Nobody could tell them when to use it, when to stop, how much they want to use. The other thing, like I'm saying, when certain drugs that people use and because of their body, some people who smoke similar cannot be inside when they smoke similar because of how their body reacts. And we have these same instances in our OPC when people have these bad reactions. Like you may hear people say they hot, they fire some crawling on them. We have those same problems in our OPC. You know what I'm saying? So like for the, as you would say, what the buildings look like.
Yeah, the square feet.
So
like you could compare it to like Wendy's versus.
All right, so you see that building across the street right there?
I don't need exact numbers.
Our East Harlem, we have 4 floors.
Oh wow. Okay.
It's like the size of that building with
right
the
there.
red one.
Right.
Okay.
And the other one's about
Heights is a little smaller. Both facilities are getting renovated right now.
Right.
So because we've outgrown the space and a lot of the stuff was old. So yeah, I would say the East Harlem building is about the size of this one, and the Heights building is maybe just a little bit smaller.
So what we're trying to say is that like from where we started 2 years ago, all our services has increased. We're seeing more people wanting more services. And it's like within the next 2 years, we're probably gonna outgrow that space. So you will look for something kind of new that will, you can project what it's gonna look like for the 3 to 4 years after you're open. Because like I'm saying, the popularity, people coming in, the word is being spread by participants about our services, so everybody's bringing their friends there. So your number's gonna be increasing every year.
And what are the services that they're asking for that you guys add?
So all the services that are named that they're asking for, but the number one problem that we're having, just like everybody else, as you all know, is housing.
Housing. Okay.
So before I go to Whitney, I do want to jump in here and ask a question. I'm not familiar with the Heights, but I am familiar with East Harlem. I used to be a public defender at Neighborhood Defender Service of Harlem. So I am familiar that East Harlem used to be a place with a lot of drug services, okay? A lot of drug treatment centers, inpatient facilities were located in East Harlem. Then developers came in and they moved them to Ward Island. So some of the questions I was having, because what we have here in the hub is a high concentration of drug treatment facilities. And we, our residents are very concerned with, honey, not another one. I gotta tell you, there's gonna be a lot of pushback for not another one. So I wanted to know in the East Harlem, when they moved facilities off and they let you guys exist there, can you guys absorb some services? Meaning, I know you guys are looking for wraparound services. I know you guys are a drop-off center and things of that nature. I know you guys send people out for detox, but I do know based on the insurance report that the goal is maybe a 24-hour facility in one day and things of that nature. I don't know if you guys know their hours, 7:30 to 11 p.m. It is a big hour block on the weekdays and weekends, shorter hours. Could your organization in the future, as you guys plan for the future, be with proper licensing, obviously, from the city, maybe a Suboxone center or a methadone clinic center or a drug treatment facility, right? Because I'm thinking if our community agrees to this, if we advocate for this, it's going to be an uphill battle if we were to, they would like to know that we're giving you one and removing two, and then you don't need two. That I think that, as the attorney who wants to negotiate, it feel like that would be a fair negotiation if that's a possibility.
So we do have MMTs there. We do give out Suboxone, buprenorphine, Vivitrol. We give all that out there.
Oh, okay. Oh, I didn't know that. Okay, thanks.
Not because, like you're saying, is that everybody's goal may not be abstinence, but for those individuals that come in that want abstinence, that don't want to go to the methadone program and want to try something else, we give individuals choices on what route they want to go. So that's why we have the MMTs, Suboxone, Vivitrol, buprenorphine, and stuff there. You know what I'm saying?
Oh, that's great.
Yeah.
Go ahead, Whitney.
I was just going to ask about costs in the East Harlem area. Do you know what the cost per participant is for individuals who are coming through the door?
So all our services are for free.
Yeah, I didn't mean for them. I'm asking you.
That number is above my pay grade. I mean, like I'm saying, you could get the numbers. You know what I'm saying? Because there's nothing that we're hiding. You know what I'm saying? And like I said, that's why we want to invite the majority of the board. Like we're to bring 10 people in for a more inclusive, informational tour of the building. You can see things hands-on for yourself. You can sit down with the senior team that provides this tour, the ones who put all this together, and y'all could get more in-depth questions answered from them. You know what I'm saying? I'm not going to sit here and say I know everything. You know what I'm saying? I've been part of the tours. I've been part of help initiating this, but there's certain things on certain levels, I'm just not. I don't know.
I do want to say that you're being very honest about things. I do want to tell the community board that I did reach out to Parks for Washington Heights because the on-point location in Washington Heights is very close to a park. And one of the issues we have here in the South Bronx is St. Mary's Park. And I was like, hey, can someone figure out if they thought it was helping On Point's presence was helping some of their own drug issues. And to be honest, some of the parks was like, well, some people still like to do drugs outside, just like you were saying. Some people still prefer to do drugs in the park, even though On Point OPC, like you guys call it, is right over here. And so, yeah, so we can't sell it as a solution when some people are not gonna, regardless of how much statistics we tell them, might still feel like did this help at all?
Even like with having a facility, you also have to have a really strong outreach team. Like it's just not, you have to have people out there engaging with participants, letting them know what you have. So I know having the OPC is the goal, but we gotta have people outside. Let's say there's one right here, St. Mary's is still right, like that's, in reality, nobody, if I'm sick and I wanna get high, I'm going right there. But if you have people that are working with the facility, encouraging folks to come in, that's gonna help a lot. That's real huge. Like the watch, like we're right across the street from Highbridge, so we have like somebody like Will's in there 6 hours a day, like picking up needles, telling folks to use the kiosk, leaving community Narcan kits, showing, providing wound care, and escorting participants back to the facility. Sometimes it's overpacked. That's another thing. Like I said, we are growing up space. That's a lot of the public drug use happens for that, because we literally just can't fit everything. I would say half of that, how do I say this? Half of the public drug use that's happening, in my opinion, because I'm outside every day, is because it's too crowded in the OPC and they have nowhere else to go, especially Highbridge.
Yeah, it is a smaller location. Before I see you, obviously, Chair.
Yeah.
I do want to say, and then I see Emmanuel, Chair, and then Emmanuel. That is something we were talking earlier this morning, is that when we fund organizations, we need to fund them sufficiently enough so that they can protect the people inside and try to help the people outside. So I completely agree with you when we think about the future.
So what we're saying about see for injection drug use in East Harlem, we have 8 booths for people to come in to inject. So we have a smoking room where we fit 8 to 9 people to come in there, you know what I'm saying? So, and we rotate that, you know what I'm saying? So,
that's
really so at times, yeah, that's what I'm saying. At times too, like to say, it's a waiting list. You know what I'm saying? And we understand the fact that people are sick, they need to use right then and there.
To maintain.
But, and sometimes we just don't even have the space to let everybody come in, you know what I'm saying? Like I said, we have a small place, our drop-in center, and the OPC, our occupational level is 72 people. You know what I'm saying? So if you got 8 people in the booth, you got 15 people in the back, and then you got individuals that's in the drop-in space, you know what I'm saying? Yeah. So we're trying to rotate people in and out as quickly as possible. Go ahead, I'm sorry about that.
Is there data that you guys can share with us on how many folks are coming from this community, the CB1 district, that are going into these facilities in East Harlem and then the Heights?
Go back because we record.
It would be good to know the data, like to know how many are coming from this district, but also I'd love to understand what the schedule is for On Point in this community. So when are you guys out here?
That's the man right there.
So we're here, 8:30 to 4:30. We're working in the Bronx.
Monday through Friday?
Monday through Friday.
Saturday, Sunday?
Monday through Friday.
Okay. No Saturday, Sunday.
Not yet.
On occasion, we might have special events or special, occurrences that will bring us out. But the schedule itself is Monday through Friday.
And this particular neighborhood, you mean, right?
Yeah, for this district. So
we're here from 9, I would say from 9 to 12:30. But not just St. Mary's, we're going to
in the morning, right?
Yeah, 9 in the morning. Patterson, Willis, all the what's the other part?
Melrose,
the church, yeah.
So that's Monday through Friday, 9 to 12. And how many people you have on the ground doing that here?
8.
8 people.
7, the actual team. We also bring field case managers with us who, will address mental health concerns. We also come out with, we're working in partnership with some doctors that come with us. We're trying to expand that program. And I did want to just address the one point about how many from this area are coming to the facilities in Manhattan. I can say that there is the interest is really there from the participants we have. And we develop very close relationships with the participants. A lot of us have lived through many of the same struggles that they're dealing with on an everyday. Issues with opioid addiction, issues with incarceration. These are things that we're all familiar with, that we've lived through. And we develop very close relationships with our participants. And there really is a desire on their part to have one closer to home. We do drive, we put them in the van, they'll come with us. But I think that really there is, as Terrell was addressing earlier, there is, their network, their friends and whatnot are in this area. And there really would be an interest. I know that from working with our participants.
I saw Bronx Mobile may have a direct response.
Yeah.
Sorry, I thought they had a direct
I was just
response.
gonna add, so Bronx Mobile came into existence because we noticed a lot of harm reduction organizations were 9 to 5. They became very business-minded, 9 to 5. We came into the picture because we saw the overdose epidemic happening firsthand, and we decided that the Bronx needs 24-hour care.
Right.
So we started doing outreach overnights to see what was happening overnights. And then we modified that to the times that we know our participants are on the streets. So we started as working on weekends and holidays, and now we've gone completely 7 days a week. So we're talking.
So what are your hours?
Our hours are, our weekend hours, we usually in the field from like 11 o'clock to like 7 o'clock in the evening.
11 a.m. to 7 p.m.
To 7 p.m. That's Saturdays, Sundays, and holidays. That means Christmas morning we're out there, Thanksgiving Day you're with your families, we're out there.
And how many people you guys have on the ground?
We are now maybe about 12 staff, but in outreach it's like maybe 4 of us, maybe sometimes 2 of us.
Okay.
We have worked closely with Brandon. We have all worked together. Yeah. This is a tight-knit community. Harm reduction is like a family.
Yeah.
Our participants are like family. I spend more time with my participants than I do with my own family. So I just wanted to add that. One thing that we don't do, unlike them, we do not go into parks. We go to directly, so if you see AutoZone, you see all around AutoZone, we go directly to that wall. We go directly to where they are. We go directly to where the drug dealers are dealing. And we interact with them so that the community can see us with the participants. They know we're part of the community. We know each other on a first name basis. And whatever issues they have to deal with, we work it through with them. We'll refer them either to Home Health or other organizations, Satcher, St. Anne's Corner. We try to fill in the gaps.
Yeah.
Where we've seen the community fail before, or organizations that are bigger than us fail, and now we fill in the gaps.
Yeah, if we could request the data on how many of the Bronx sites are at the center, that'd be great.
Emmanuel, I know your hand was up.
Yeah, I have a 2-part question. For one, you mentioned outreach, and I'm just curious to know a little bit about language access within outreach. The services that you all provide accessible to, let's say, Spanish-speaking folks?
Yeah, so our teams are made up of people who have shared life experience, whether it be Black, Hispanic, white. We're not choosy, you know what I'm saying? One of the things that we do notice when it comes to the injection piece of this, we know that there's more Hispanic people who inject drugs than African Americans, you know what I'm saying? So we do have a diverse team that is Hispanic and all that. The language that we use is, I will never call you anything that you don't want to be called. Respecting the individual. You know what I'm saying? Yes, ma'am, no, ma'am, how you doing, sir? Or call them their nickname, call them nothing outside of their name, you know what I'm saying? Because it's a mutual thing of respect of this person as a human being. You know what I'm saying? They've been degraded so long and called every name in the book, you know what I'm saying, that we stay away from language like that, you know what I'm saying? As I stated earlier, it comes from a place of love because, as Tom stated, majority of the outreach team has been homeless, has used drugs, has been through all the systems and know how it is to be treated, you know what I'm saying? So we don't want to have people relive that, you know what I'm saying? One of the other issues that you guys have around here that, that is very important, your drug supply here is very cheap. You know what I'm saying? Y'all got $5 bags, $3 bags, $3 bags of heroin, you know what I'm saying? Xylazine, all that stuff there. So it's so cheap,
It's accessible.
very accessible. You know what I'm saying?
So
We have spoken to dealers. We have had them give us samples of their products. We have tested it. You know what I'm saying? Come back and let them know what's in the drug supply. Because I think you guys need to understand that small portion of them is not here to kill anyone. They're trying to make a monetary gain. So we come out, we educate them. We will never give up their name. It will always be anonymous. You know what I'm saying? Because one of the things that a lot of them used to come to us for is Narcan. And we used to train them on giving Narcan. Yes, the dealers, yes. We used to give them Narcan, you know what I'm saying? Because they've seen us responding to overdoses. And one thing about On Point, our response to an overdose crisis is different from any other agency in New York City because we use the oxygen protocol that no one else is using. You know what I'm saying? And every member of the outreach team, the OPC, every staff is trained to the level of a nurse to respond to overdoses.
Can I ask my second part question?
Yes, sir.
So I must have missed this, but I'm just curious to know a little bit more about the arc of services y'all offer. I'm looking at this packet that was put together by an intern, and it talks about, thank you, it talks about some support you give to users, housing, employment, and whatnot. I'm curious to know a little bit more about if there's any advocacy work that y'all try to incorporate users into, and if there is anything else that really differentiates you from, like, let's say, another agency that's existing in Mott Haven at this moment in time.
All right, so advocacy work. That's what I do. Get our participants involved in advocating for themselves, advocating for services. We take busloads of individuals up to Albany. We take individuals to City Hall to learn and speak for their own rights. Yes, you know what I'm saying? Under the harm reduction umbrella, as my brothers Lucas said, we are very close knit with a lot of the harm reduction agencies here. Why? Because and I hate to say this, people get mad. We have individuals now because harm reduction money is being spread out. People who do not practice harm reduction now say they're harm reductionists and give our work a bad name by co-opting it. That goes back to opioid settlement funds. When you sit back and look at how many Oasis licensed places sit there and talk about they do harm reduction work, but you only give out Narcan. And the bad thing about it, we sat up today in Pope Park and watched a lot of the agencies only distribute Narcan and did not train one single person on how to use it. That's why we call people Narcan cowboys, because you only give a person Narcan when they're unresponsive. You don't give them to them when they're happy or woke. You don't do that. We sit here fighting for funds, and you got the other agencies that are perpetrating the work that we do, getting all the funding. And I'm not scared to say it because I'm an advocate. I say in the hopeless face, which I have already said in her face. So we do a lot of advocacy work to ensure that we get the money that we're supposed to get. We also have advocacy for our participants to learn how to speak up for themselves. Like we send individuals, I don't know if people heard of Vocal New York. We collaborate with Vocal New York. You know what I'm saying? So yes, we do so.
So this is gonna be the last question. Okay. Whitney is gonna be our last question on our community board. And then DM, we'll end with the district manager. Okay.
I actually did not have a question. I have a point of information.
Okay.
I just wanted to note that the intern report is incredibly thorough, but that On Point is one of a kind. It's a unique program. It only exists in New York City. There are no other overdose prevention centers yet, but they are at the forefront, and there are other states replicating this model. Just this in the last year alone, Minnesota, Vermont, and Rhode Island have passed legislation to get On Point type programs implemented in their jurisdictions because it is the best way to reduce overdoses, to reduce deaths in the community, and it's cheaper than putting people in incarceration to throw them away while they are dealing with their substance use. So I just wanted to make that point of information.
And another thing that was talked about a lot this morning is that we cannot arrest our way out of this. The best you can get from a person with some substance on them is 7th degree possession. That is a walk in through jail and walk out. So you couldn't even keep someone in jail long. If they are sick, and I stress this a lot, we do not send the police to sick people. We send medical attention. And if we have the police in places they don't need to be, chaos breaks out. So, go ahead, Terrell.
So, and this will be the last thing. So we have built a beautiful relationship between the precincts where we attend roll calls. We educate those officers on the services that we provide. They have in turn, so they're wrestling their way out of it, they have brought individuals into our program for services. So we try to change that whole dynamic about us being against the police and all that. We're working with them where they do outreach with us. We set up tables with them in the community, you know what I'm saying? So we're still working on the same strategy up in the Heights, you know what I'm saying? That's what Brandon does, but we'll do that in the 25th Precinct Hall, I'm saying.
So thank you for that, because I want to get as much information as possible. I am working with the district manager to get some police feedback from the 24th Precinct and from the one in the Heights to see what their point of view is on point, because obviously we're discussing things, but the community board and the larger community at large will have very strong feelings about this. I see your hand, but I'm so sorry you brought it up so late, because I really want the last thing to be our district manager. The agenda is so long. Okay, 30 seconds. You're not good at that, but I'm trusting you. I'm trusting you.
What do politicians have to say about this? They're the ones who advocate the funding and create the policy for the best local right now.
Diana supports it,
Mayor of the 40 precincts stated a couple weeks ago, you got 27 restaurants in the 40 precinct jurisdiction. What do politicians have to say about this?
Herman, politicians do not speak in one voice. So
I think the city council member Diana supports it.
Okay, go ahead.
All right, so we have Senator Rivera, Gustavo Rivera, who's our champion. He just put out a bill, Safe Consumption Service Act, which will allow centers like On Point to open in high impact areas. Right now, there have been a lot of the politicians who have signed on to that bill. Linda Rosenthal and the Assembly also has a bill sponsoring this with a high number of individuals who responded and signed this bill. We're looking forward to, in the future, to have many more individuals sign on. But again, as the young lady said, Kathy Hochul is our obstacle course at this moment right now. She will not sign, because she could take by signing with pen to authorize these centers to open up immediately. She can do that. De Blasio did it on his executive order. He had 4 of the 5 district attorneys sign on to it. The only one that didn't sign on to it was
Manhattan.
No, Manhattan signed on. The Bronx.
Oh, Staten Island.
Staten Island.
Yeah.
The only one that didn't sign on to it. So we have the protection of 4 of the attorney generals in all boroughs. I'm sorry, sir.
Thank you. Sorry, I don't mean to interrupt. Since I'm the only person here that actually represents an elected official, I just want to very quickly, the administration has shown and our mayor has shown that he is a supporter of harm reduction.
He visited us.
Yes.
The mayor came down.
And the mayor has, especially with his law enforcement background, his understanding of the challenges that our community is facing. Not only has he been a supporter in word, but got checked too. And I think that's one of the biggest things that shows that support. You know, our mayor has allocated probably over $50 million a year fiscally to harm reduction programs, and that will always continue under our administration and this mayor as well too.
Has he been putting that money towards OPC or the old traditional harm reductions? Okay, so you guys haven't really seen an increase of funding from the mayor?
A little bit, you know what I'm saying? But I think the highlight, like the gentleman said, was him coming, visiting, and stating he supports us, which brought a lot more people on. You know what I'm saying? Seeing that he supports us with the individuals he brought from his staff or other people, you know what I'm saying? For him to come in, see the work firsthand, and get a moment to talk to participants about how they feel about the program was very helpful impact for him to understand the work that we do.
And bear in mind, not just the budget allocations, but the Department of Health is also a primary supporter and funder of harm reduction programs as well.
Thank you to my colleague at City Hall, who's always willing to come in and work with us on the very complicated problems and bringing back sensible solutions. We appreciate the administration's work on this, and we're always going to push and ask for more. Yes, it's always more, and because that's always important. Thank you to the chair for your leadership on this conversation, as we know that we took an interesting opportunity to walk around with the administration and some city agencies today with our colleagues, and that we been and learn about all the work that our district needs and what we need to help around this issue and many other issues as it impacts our district. I wanted to ask a question in reference to your when you're working to bring about your team. Is it mostly all volunteers at the beginning, or from a clientele that is coming on, or is it other folks that come? Like, how do you work with people who come volunteer or are interested in supporting your work? This is from one of our board members who's asking this question.
All right, so people can come volunteer. We do have a volunteer program. So if individuals want to come and work with the outreach team, there's some trainings they have to go through.
Sure.
You know what I'm saying? Submit litter, cultural competency, other things in place like that, you know what I'm saying? And we welcome people to come in and volunteer, because what we want is we want people to see what is being done here.
And we also think about community ownership of stuff like this. Right. The community understands that taking ownership in something like this, then you become more of an understanding.
Right, because and you're 100% right, because we want the community to come. We want them to be involved. You know what I'm saying? That's one of the things that we do. We hire from the community. We hire former drug dealers. Why? Because they want to change their lives. You know what I'm saying? They saw what they were doing. They're like, nah, I'm tired of this. I want to do something different. They feel that because they were on the wrong side of what society says, they want to now correct those actions. So we do train a lot of community members. We bring them in. You know what I'm saying? We make it feel as on point is theirs too. They have say-so in what goes on there. At our meetings, our PAB meetings, we take input from the community members. You know what I'm saying? And what direction and things that we need to do.
And former addicts.
Users.
Yes. Because I was a user, and then I would not work for them.
And that helped me. That's what goes to my next question. If a person is looking into going to recovery, coming off of using actively or using a maintenance program like methadone or other racist program, how do you encourage that and support that as another way to working in your program, not working as a separate, but going through your program?
All right, so okay, so here it is again, as you would say, I'm an individual who just came out of, you say, 12-step or rehab, something like that. I want to have a job there. We're going to closely monitor this individual. for the simple fact because if we see that he's starting to be triggered by this work here, it's time for a conversation. Is this the right place for you? We don't want to be accountable for you going back out there using. You're going to be shameful of it because now you done went through this program here. All this time you abstained. Now you go use. You're going to feel bad about this. So, and the worst thing about it, because the system has been clean and naive from opioids, you may go into an overdose and may be fatal. So it's about us having conversation, watching the individual. Yes, at times our conversations are rough. It's about accountability for your actions, what you do, what we see, and they're private and confidential. It's for no one else's ears.
And my last question, and thank you, Chair, for your those that are going to move forward, is harm reduction. And this when I get an understanding of my understanding of definition of harm reduction is the exchange of a used needle for a clean needle with in addition to other resources and services, or is it? And it was more to that. But the initial was about exchanging of clean needles to help with the issue of the growth of HIV and AIDS and other these intervening issues.
Yeah, exactly. That's what it was going out of the backpack of individuals who want to fight against spread of HIV, hepatitis C among active people who use drugs. You know what I'm saying? We no longer do the 1-for-1. We give people as many surrenders as they need. We ask people to return them. You know what I'm saying? But we also do educational pieces every time we engage with a person about returning their surrenders, safer injection. We give them a fit pack where they can put their dirty surrenders in. You know what I'm saying? So everything that we do, we educate individuals on what we give them out.
Right, because as you understand and you know this because you guys are part of the cleanup of the work that's happening with needles that are being left in places that are untraditional spaces. I just want to learn more about how that works with the exchange of needles to clean needles to hopefully with that. So thank you, Madam Chair.
Okay, so I just want to tell you guys next steps. This conversation is going to be ongoing. So I am not the Health and Human Services committee chair. I am bylaws, policy, and legislation. Well, not bylaws. I fixed those. You guys are going to vote on that in September, at the end of the month. So policy and legislation. So the goal, you guys, is really, I hope as the committee chair for policy and legislation that we write lots of letters in support or opposition of things. And we are going to continue to hopefully articulate a position about how we feel about a safe injection location here in our district. St. Anne's Corner Harm Reduction, they're interested in expanding their their services to safe injection. They're getting obviously a lot of pushback. We'll be meeting with them next month. I would love to write a letter to our amazing governor about her positions on funding. And these are things that we would write in support or in opposition. Obviously, once we vote in our committee, we present it to the full board and we can start advocating at least that the board has taken a position in the future. So as we meet with, nice to meet Bronx Mobile, nice to meet you guys on Point, which are their legislation, their policy team is coming next month. Those are what the future looks like. For my committee members, please read the interns' papers, please read the articles I printed out. So therefore, when we vote on things, people are fully informed. Hopefully I can get the police reports or the police precincts positions that are near on points in the city. So you guys can use that when you guys are in the future going to vote on a position for this community board on these type of various policy and funding. Okay, so that is, thank you On Point for your presentation, and I'm glad to be working with you guys. It was great, and I think we learned so much. I do want to say there's some things that are not here that are very important, you guys. District needs assessment. Can someone tell me what that means right now?
Sure. Thank you, Madam Chair. So as we've been going on to all the committees, especially Health and Human Services, we've been talking about we are in what's called District Needs Assessment period, where the members of the board are going to be articulating to the full board from your committees, what are some of the things that we need to be recommending through the process that goes from the community board and our report to the borough president's office, then to the mayor as we look at the next fiscal year about what are specific things we need to do to help improve in our community around health and human services, as we look at the work that's being done around harm reduction, the work that's being done to combat HIV and AIDS, or infant mortality, or a bunch of things that we are impacting in our district. We are going to be having a broad discussion about this and voting on this issue in our October meeting. So as we go forward, please be mindful of issues in your committee areas that we should be discussing as priority 3 top priority issues in your issue area. That goes from here to the full board, that goes into the district manager's final report, that goes to the borough president, and then to the mayor, specifically for community board 1. So I wanted to make sure that people know that this process is going forward, and we're on our way. So please be mindful of it. And I'm going to turn back to the chair. Yes.
Just a clarifying question. Is this funding programmatic or capital?
Both.
Everything?
Yes, everything. So
So we'll be talking about this.
You got a list.
You know.
So we'll keep that in mind. Start percolating in your head about that. Something that is not on your business that I really am going to harp on. This might be very, maybe not for health and human services. The back of the ballot, we are voting in November. There are 1 constitutional amendment, 5 charter revisions, and policy and legislation. We will have a beautiful presentation for our community board about the back of the ballot, because New Yorkers who vote still really are bad at the back of the ballot. So that is something I'm going to concoct and be prepared for next month, is the summary information about the back of the ballot. Regardless of what you feel about the people, we have a constitutional amendment and 5 charter revisions that I cannot tell you how to vote, but I will inform you so you can make really good decisions. Okay, we're gonna go to I'll point. If you guys don't want to stay, you guys can leave. I'm so sorry. I totally missed that part.
You can stay.
Yeah,
It's a good
you
time.
stay if you want. Also, Bronx Mobile, thank you. If you guys don't want to stay, we'll see you probably next month when St. Anne's harm reduction comes or whatever, or when the rest of your team comes on point. But you do not need to stay.
Thank you. Thank you.
And we are so grateful for you.
Thank you. I want to thank you all for inviting us. You know what I'm saying? Any meeting that you would like for us to attend, just reach out to us and we'll be here.
All right. Thank you so much.
Thank you. Appreciate it. Thank you. Good night, everyone.
Good night.
Good night.
Good night.
Thank you.
Good night.
Thank you, Madam Chair.
Okay. All right. This may be a little boring, but City of Yes Housing is going to City Council. We, as a community board, has not taken a position on it at all. And we need to take a position in writing. We need to do that soon. So we're gonna hope that September, you guys, where is that checklist? I'm so sorry. Yes, this, where is that? I'm so sorry. Okay, oh, there it goes. Right here. Okay. Not yet. I am going to, usually what happens, you guys, is that as a community board, we vote on something. Then at the Bronx Borough Board meeting, all the community boards vote on it, and then eventually goes to City Council. Oh yes, at the Borough Board, I do want to tell you a random fact I learned. City Council's there as well, and they vote too. Not them themselves, but their representatives vote as well. So all 10 community boards vote, and City Council members for the entire Bronx votes, and then whatever happens, then it goes to City Council. For some odd reason, we have not voted on this, not on our community board, also not at the Borough Board office. However, it's in City Council, okay? They're percolating on something we haven't taken a position on, and that is not good. I'm not okay with that as committee chair for policy and legislation. So what I would like for us to do is this checkbox, you guys. We are going to vote on things, and It's gonna go to the full community board, don't worry. It's gonna be at full community board as well, September 26th. And then I will type up a beautiful letter that Ayala and Salamanca will receive. That is a reflection of our board's position. So therefore, city council members know that community board cares about everything that they vote on, okay? All right, okay, so hold on, so I don't know if any of you guys recall, because we don't have any new members here. We, as a community board, did get a presentation from DCP, Department of City Planning. And we didn't vote on it. It's pretty old at this point, but I'm gonna share my screen once I open something for you guys. Give me a second. So just to summarize for Health and Human Services, community policy and legislation, we've talked about this until we're blue in the face. What am I looking for? Okay, and then I'm gonna share. Hold on. Oh, great. Okay, so I'm just gonna talk to you guys from this only because I just want to summarize some stuff for you. What you guys are looking at right now is something I will be blue in the face about. CB.
Can you make it really big?
Hold on. Command plus.
It should give you like there it is, the zone.
Okay. All right. Okay. Community Board 11, which is East Harlem, which is Diana Ayala's other community, their other community board. They have an expert, you guys. They got an expert that is synthesizing 1,300 pages of Department of City Planning into plain English for them. We do not get that. I will pray that we get that one day, that we have proper funding, that experts reduce really dense regulations for us so we understand what we are voting for and we can vote with full knowledge about things. However, that's existence, and I have really summarized some of the issues. Now, town center zoning, I gotta be honest with you guys, we live in an R6, R7, we are not town center. We are buzzing, okay? There's a lot going on here. We are not our center. So for us, we can either abstain because this really does not apply. We are not a low density district in any form or fashion. And therefore we can take no position on that. And that is actually what I highly recommend, that we abstain from topic 1. Is that okay with everybody?
What exactly does this mean?
So there are some parts of the Bronx, this is not us, where, buildings are not as tall as what we have. It is about let me step back, you guys. City of Yes housing opportunities to build a little bit of housing everywhere. So to build more apartments, more residential places in all different areas. And that is the ultimate goal of it, to build a little bit of housing everywhere. I want you to know Mont Haven has built the most new development than any other part of the city, and rent did not go down for us.
It went up.
It went up. But the goal, DCP, I spoke with them, they said that because we're the only one building, everyone comes here. So therefore, if everyone built a little bit everywhere, then rent would go down. But because we're the only one building, rent did not go up. And so town center zoning is not applicable to us. It really doesn't change anything for us, but it is about building more housing in low density areas. Okay, go ahead.
So my question is, when the vote actually happens, there's not going to be, we're really not going to stand in power if we abstain. So although this doesn't maybe directly impact CB1's district, although I think that there might be places in CB1 where it might, I think that we should take a stand on it before sending it forward.
Okay, and again, I want to tell you guys that our full board meeting, we have to have this conversation again. So Herman, you're go ahead.
That whole message is critical. They talking about housing, yet they're putting that damn jail over there. If anybody study history of the Bronx House Detention, when they opened that place up in 1927, they stated that the Bronx House Detention is an avenue for economic development in Bronx County. It's a vacant lot over here right now. Now they're gonna put a jailhouse over there with every other council person in this county said no in their district.
But what does that have to do with?
Because a jail is housing.
No, so
I told them straight up
can we
front,
just stay on
put
town
the jail
center
on top of the
housing?
courthouse. No, they want to put over there 141st Street.
Herman,
Lester Block Elementary School.
I totally
grew
agree.
up with this nonsense. Hell no.
I totally agree.
You have to put a person in jail in New York City. Oh, $600 a day, excuse me.
I totally understand.
That's a waste of money.
I totally understand as a public defender your frustration, but that is a rule that has passed that is beyond us right now. And I understand and grieve with you that a jail is not connected to its courthouse like they do in other places, but that is beyond us right now. And I still want to make sure that we are even when they don't ignore us, we need to continue to speak up. So I want us to make sure we use our voices here. Okay, thank you, Herman. So I hear you, Ramona, as to the fact that abstaining is still has some some collateral issues, and therefore we should take a position on that. And so,
because you're going to be making a proposal to the general board based on the conversation we're having on this tonight,
yes,
right?
That's true.
So abstaining really doesn't.
Yeah, and that makes a long conversation for the longest meetings we have. Is our full board meeting. So and again,
Mayor?
yes, you can. Yes, the mayor's office, the only person here. Long meeting for you.
That's fine. The only point that I want to apply is while you guys are considering your vote, please bear in mind that the mayor's vision with the city of Yes is that the entire city, all 5 boroughs, works together in order to alleviate the housing crisis that we have here in the city. And while I know it's always, when folks vote on things, it's always your first instinct to think about how does this particularly impact the area that I live. We understand that, but ultimately this is a city issue, and ultimately when you give this thing thought process, we have to do everything possible to bring up more opportunities and locations where people to live everywhere in the city. Because if not, it's still, even if this particular zoning aspect does not impact this particular area where we live in, it will, because that means that there will be less opportunities to develop in areas that this zone actually applies. So just wanted to give that bit of feedback.
So we can always, I tell you guys, support, do not support with recommendations. DCP is very stressful. They want to hear some feedback. So we don't take absolute position without feedback on how they can modify it. And, you know, the housing crisis is real, but the housing crisis is twofold. One, it's supply, and one, it's affordability. And so there are parts where I have very strong opinions, you guys, but let's get from topic 1 off the table. So if we are going to talk about, and I want to tell you, Queens is dying. They is no for them because it's a very low density area in parts of Queens. So, you know, my position personally would be, you know, maybe support with requirements of, 20, 30%, 40% affordability for sure. You know what I mean?
Then
and those are things we can say to give you guys example. Okay, let's go, you guys. One more.
So I think in the conversation regarding town center zoning, like we need to consider whether or not this is going to be new construction or existing buildings turned into this, right? So like we need the Department of Buildings to clarify on that. And if we're going to be asking for like 25% affordability, we need to be locking into the AMIs that are not served by current affordable housing developments in CB1. So what is the AMI for ensuring that someone that earns $12,000, which is like 50% of our community, is eligible for these new buildings?
So AMI is defined by HUD.
No, but there is an AMI bracket that is linked to $12,000 a year, which is the poverty level. So we're bringing in new housing and allowing it to include entrepreneurial space, then it has to serve 50% of this community, which continues to be left out of development. So that AMI, I think, is like 90%, and we haven't seen a 90% project. I could be wrong. Emmanuel probably knows the numbers better than me, but if we're not at 90%, then no.
AMI. Okay. All right. So I hear you. So there's some really good stuff, but you're saying depending on credits, you're going to see when I go down, it can go down to 60% AMI. But if I hear you saying that no less than 90% AMI, I think that is a really...
Yeah, because what's 60% AMI right now by HUD? I'll Google it for you.
Okay. We have some recommendations, even though we don't have a position. But I guess because we need DOB to clarify something new building, you're right, because they might have to break those stuff down to build on top of it. Transit, hold on, you guys, let me...
Yeah, like 30% is 32,000. So that excludes 50% of our community. So
still too high.
Yeah, 30% is 30% AMI for one person is 32,000, and like 48% of us are at $12,000, including myself.
I would tell you guys overarching, because I really want us to go one by one, because this is going to be, I want us to go home. And
but this is going to be the recommendation we're making to the board.
Yes, I hear you. Right? I hear you. So you're saying, I want to be clear, the city of housing opportunity, even though the mayor's office is right here, does not do enough in general for affordability. It does not. It does a lot to develop units, but it does not do enough to protect that those units are affordable. And that is a major issue, especially in this community where a lot of people are below the poverty line. Okay. So there's no denying that. That is the overarching summary I will have when I read this letter in support, that you are going to develop units for a city that is at 8 million people. It will never be enough. So demand will always be high. So real estate developers always get their pick of people. And therefore,
so maybe we just take like a gut vote. And if we say yes to it, then we make recommendations for each one, like make speed votes.
I mean, well, we can't deny the whole thing. We can't.
Yeah, we can.
Well, we have to look at it one by one and deny it one by one by that.
That's what I'm saying. So let's do speed votes, maybe.
For
everything, like just go down, and then if people want to support one, then for that we attach requirements.
Okay. Okay.
Because I think in the few conversations we've had in committee and at the board, we haven't been fans of City of Yes.
We haven't, you guys, and I think that's why we haven't done anything. But that our silence is a problem. Our opposition is okay, but our silence is a problem. So town center zoning.
Do you want to do like a roll call vote real quick for each one?
All right. First of all, do you guys want me to scroll back up to that section?
No.
Okay, you guys got it. Okay.
Does Stephen need to be here for the vote?
Can you pass me the clipboard? Go ahead. Hold on, DM. Hold on. Go ahead.
I mean, I don't know what the rules are, but I'm suggesting that we do speed votes on the City of Yes components. Yeah. Exactly. Like just do.
Majority.
Oh yeah, majority. Yeah.
Yeah. Okay. So.
And then the vote is for board members.
Yeah.
To be clear.
For the committee.
Well, I 100% have quorum for my board. For my committee, but everybody can vote, but I 100% have quorum.
So we can vote.
Yes.
Yes.
Okay.
100%.
So this would be a vote. This would be a vote for the committee on policy legislation, voting on these issues.
Which
is policy legislation. Where the members are only Stephen. Can you call policy legislation members?
So the rest of the committee have to. I gotta redo those.
That's why you get. That's why you do what you do.
Okay, go ahead.
Learning the more. How do you vote?
Abstain.
Bro, we're not abstaining because we can't abstain at the board.
Okay. Do not support. Yeah.
I mean, I'm not bullying her, but we just had a whole conversation on not abstaining because we need to make a statement. There we go.
Ramona Pereira, how do you vote?
I do not support town center zoning, right? We're doing one by one.
Yes, one by one.
Emmanuel Padilla, how do you vote? Whitney Williams, how do you vote?
I abstain.
All right, of course, that does.
Okay. So transit.
Again, this is another area that really is not unique to us. However, I did check. St. Mary's 0.5 miles away. Okay, again, remember you guys were like, we're R6, R7, but while this part is the part I want you guys to understand, while the increases are only available on blocks within half a mile of a transit station, St. Mary's and those areas like Elton, they are single family blocks, you know? They're not really that busy. So it's gonna increase housing in those areas. Our community board is very passionate about parking and the lack of parking. And so every time they build a building and no parking shows up, we lose it. But I want to say that about that. Go ahead.
My only question about this is in that space that you're thinking that this would become possible, are there actual lots that the city will be able to use towards this, or are lots all fully occupied?
I think they're all really, for our neighborhood, they're all fully occupied.
Okay.
They're really kind of occupied. They could do something with the post office.
Like 149th and Grand Concourse.
There's one over here. Go ahead, Emmanuel.
Can I change my vote on the town center zoning? I just feel like I need more information.
I mean, you have the whole expert in your email, the report in your email. And also, here's the thing. I want us to start percolating about this, even for the members our board members who are not on my committee who can't vote. This conversation is going to go left on the 26th.
Yep.
Please, through God, read. Please, like, DCP has videos and everything. Anybody who emails Stephen or Anthony, I will send you the expert report, which is a bit objective. I really love objective materials because obviously DCP has a lean on it. And so, but we need to get it out of committee. And if we don't get it out of committee, then we don't get it to the board. And our silence is way more problematic than our opposition. Okay?
This is the last time we talked about this was in June.
Yes. Before we left for break.
A little bit more time.
But you can also, I
want to abstain.
Okay, you can abstain. That's fine. It still died, but you can abstain. It still died. But this conversation will get you prepared for our meeting on September 26th.
Yeah.
Because we have to take a position. Our silence will look like we consented to this.
Permission to ask a question?
Of course.
I think one of the things that keeps us as a group, as the whole board, that we're discussing in circles is because there's a lot of terms we don't understand and we know are important, like an AMI, like what is meant by affordable? You know, what is meant by, we're going to have modest. What's a modest building? What does that mean for the community?
This is very good.
It's really challenging when we need details.
So it's really good. That's why I love this report that's, I think, almost 35, 37 pages. We have it, and I can share it to everybody. It has not been sent to all 50 of us, but we do have it. And what I want to say about that question in particular, you guys, AMI is a HUD number, area medium income. It includes all 5 boroughs in Westchester County. Do not ask. Real estate developers have great lobbies, okay? It does include that number. So when someone says affordable, you need to be asking the question that Ramona just brought up. Is it 80% AMI? Is it 30%? So, for example, NYCHA is the lowest level of affordability, and that is 30% AMI, right? So when a building comes...
Well, no, NYCHA is based on...
30%. I live with NYCHA. 30%,
but she said 30%.
She
said 30% AMI when it's 30% of income.
Oh,
up to
$120,000
$120,000 a year.
So when you asked about modest,
so that's the beauty of it. It's not linked to AMI.
Okay, so when you ask about affordability, we're going to do a ULURP on September 26th. That also did not survive economic development. It is a question about affordability. When you ask about affordability, you're always going to ask what percentage of AMI. And the lower that percentage, the more affordable it is. So 60% AMI is obviously better than 80. 60% is very good. 80% AMI is okay. You know what I mean? But they can go 100% AMI, which is like, okay.
But these are the things we need, exactly what you've just described.
Yes.
Like, we need to know. Is it 80? Is it 10? Because when we're signing off on things like affordable and modest and economic development, entrepreneurial support, well, who?
But maybe the mayor won't be there in a month.
Sorry, Leo.
But I mean, these are the things that, it's like.
So we hear you.
Let's take that into consideration.
But let's pause a little bit. I do want to pause because I want to at least have these initial conversations so then we can go back and be prepared for September 26th.
Yeah, we need
and
to.
And additionally, I do want to say this, okay? Is that this is why I get stressed out about us not having an expert. We are all volunteers. We come from different walks of life, and they drop a 1,300 raw, it's 1,300 pages, changes to city planning, and then they give you a PowerPoint presentation that is in color, that is beautiful, and tell you everything's going to be okay. Thumbs up. That, my God, is ridiculous. That is just crazy to me. So I totally understand your concerns, and even with this expert, I had to Google what is FAR, like, you know, what is floor area ratio, right? So I do understand that even when you get more language, more information, you still can be lost. But I think they're hoping we're overwhelmed and vote any type of way.
Mm-hmm.
And so I want us to be huge advocates, because I was Googling up stuff, CB9 in Upper East Side. They were like, our experts told us. I mean, they're writing reports from God knows what. You're not really building more. We're actually losing affordability units by 26%.
But I think, I think collectively we have a good grasp on what the community is going to be impacted by. And if we're taking a vote on behalf of CB1, well, we need to be looking like with transit-oriented development, CB1's not going to be affected by it. So I already know that there are other, districts in the city that should have transit development happening, while we've been stuck with all of it and absorbing it. So hell yeah, I'm going to support that, because I want everybody to share the burden.
All right,
right. So I think we just need to act like the experts of our
no, we're going to
community
go vote on this one.
and vote on the numbers and go down.
Okay, no, you have no idea how long this is. And
then if we support something collectively, then add conditions.
Okay, so go ahead. We're voting on transit. We're voting on transit.
Delorean Namorin.
I support.
Ramona Ferreira.
Support.
Emmanuel Padilla, how do you vote?
Support.
Whitney Williams, how do you vote?
I support.
All right. Okay, so then we have topic number 3 is accessory dwelling units. I really supported this. It just allows, with an exception though, it allows people who own an entire unit to build things in the back. I don't know if anybody's in California. Everybody got a little house in the back in California that they rent out for people, and it just allows them to build things on their property. And so for our homeowners, I thought that would be really good. The only modification I stated was that they tried to reduce the yard space from 30 feet. Right now, if you do have a yard, it has to be 30 feet. But for some odd reason, DCP reduced it to 20 feet. If you buy a property, you can get your 30 feet. And if you want to build something in it, that's your business. So that is just about what accessory dwelling units mean. It only happens for people with single family homes, and it allows you to build something small that is legally habitable. So DOB still has to make sure you're not building something that's going to flood or
and
whatever.
Basements.
And basements that are going to flood. DOB still is going to be controlling whether it is habitable, but it allows you to build on your property.
So it adds safety to the community overall by developing things properly in basements and backyards.
So DOB is not going to let you build a shack and try to sell it, rent it out.
Okay.
And so let's go on this one. So go ahead.
How do you vote?
I vote support with modification. That the standard residential yard size remain 30 feet.
So you want them to keep 30 feet of green space, regardless of what they do?
Whatever they do.
Okay.
Ramona, how do you vote?
Just a point of clarification. You said 30 feet of green space. Is that in addition to the yard? Like they have to have at least?
No, it's about the yard. So the yard, right now, if you build a single family home, the yard has to be 30 feet.
Right.
And DCP wants to change that down to 20 feet.
Right. Okay.
And she was saying green space as the yard as the green space.
Right.
Yeah, and I say I don't want DCP to reduce the size of someone's yard.
So if you put in like a mother-in-law suite in your backyard, you still have to have 20 feet of green space around that, or the whole yard still has to be 20?
No, the whole yard will be 30 feet.
Okay, all right. I support.
Yeah, will be 30 feet. We are not reducing the size of people's yards.
Emmanuel, how do you vote?
I do not support.
Damn.
Whitney
Interesting.
Williams, how do you vote?
I support.
Okay, district fixes.
Okay, district fixes. We making it, y'all.
So this is like additions to like your home.
Yes. Hold on.
But not for rental needs, for family needs.
Hold on. District fixes, yes, with modification. Oh no, that's accessory unit. Oh yeah, I put not applicable for us. Oh, because we don't go to, if they don't go to 6, I said mind my business. Like that's what I did.
You mean 6 floors?
No, R6. We're an R6 district. That means we're very dense district. We're a very dense district. We're R6, R7 sometimes.
But back to what this actually means, it means that
Oh, go ahead.
we would support homeowners increasing square footage of their homes, not for rental purposes, for personal purposes, is the way I'm understanding this.
Oh yeah, I changed the lots and the FRIs of those people. Yeah, in low district areas.
Okay,
Yes.
so this allows homeowners to
Yes.
increase their square footage, but not for rental purposes.
Yeah. Well, it doesn't say the word rental. What do you?
I'm putting rental because it says to adapt the home to meet the family's needs, not to Airbnb or sublet. So it must be for personal use.
So as family is larger.
So I would put that as modification. I would make sure that we make that clear. Like oh honey, why is this thing typing? No. I would put that like support only for single family homeowners or
Okay.
family
So we can vote
homeowners.
then. Dale.
Go ahead, vote.
Delaney, how do you vote?
Sorry. I'm sorry. Support with I don't know, is emphasis part of it?
Emphasis.
That's the thing?
Yeah.
Okay.
Emphasis on
Yes.
usage by family, non-commercial allowable.
You got that?
I'm writing it.
Okay.
We're recording it though, right? Okay. I support with same
Ramona, how do you
modification.
vote?
Support same modification.
Emmanuel, how do you vote? Whitney,
I'm here for it though.
Same modification?
Yes. Okay, now we get to the good stuff, okay?
Universal affordability.
Universal affordability, SCAN, okay? We're gonna support it with modification. Okay, what is affordable? So remember I told you, so one, this is an optional program. That means it's incentives. It gives you incentives to build more. If you build more, it must be affordable. My biggest problem with that is we have no mandatory affordability. And I don't know why they keep doing that to us. I keep on thinking it's the real estate law.
You know why they're doing it to us.
There's no mandatory threshold for affordability. And
this is the 80-20 rule, basically being disguised as innovation. And I think that the 80-20 rule proved to fail the city in the past.
It does go deeper. It does go deeper. Yeah, I can't deny it goes deeper. And
it gives bigger tax incentives?
No, because it goes down.
Is that the deepness?
No, it can go down to 60% AMI. It can go down to 60% AMI. We never go that low.
But the fact that we never go that low doesn't mean that that's what we should be aiming for.
The extra floor may be used for affordable housing with units that average at 60% AMI. That is very, very low. Well, let me not say it's very, very low. It is lower than usual.
$70,000 a year.
Nobody in our community is
now. It is not good enough. Okay, but I do want to say they did go. This incentive does give us more, a lower 60% AMI. Now, why is this optionary? Is a little bit confusing to me. I do want to also say that there are some talks. Hold on, let me scroll up for you guys. Am I scrolling? Why is it? Oh, it's okay. Consideration. So there's some consideration about whether it's going to be utilized or not. If you get the tax credit 485X, you guys don't. I really dig deep. That's why I'm a nerd right now about this stuff. 485X is a New York State, brand new New York State tax credit that was passed. And it gives them the tax exemptions. And so they think if you're going to take a 485X, which is another optional thing, you're going to use UAP. And that therefore will give you they'll make you bigger buildings in our neighborhoods. I want to say that. In exchange, we are supposed to get 60% AMI.
Which is $65,000.
It's so high. Which is still very expensive. Okay, I want you to know because the expert writes the stuff for Manhattan, it's not really that Bronx specific, but we are R6, R7, so we can overlap. I want you to know that 485X does not work for condos in Manhattan, which to me means our condos are going to be more lucrative. So that means more people are going to move to the Bronx or move to Brooklyn because if they want to own, which means when we do have ownership opportunities, they're going to become a hotter commodity in our borough. given the fact that they're not as affordable in the Manhattan area.
So we could vote?
But I do, I don't want to say anything, is there modifications we want in this? Because I think, Ramona, I feel your energy is about to say, do not support dead. But I do want to talk about modifications because this is the only component in the entire city of Yes that talks about affordability. Only. Nobody else talks about affordability. After that, they're thinking, if the supply is high, price will go low. That is not true. So this is the only component that talks about affordability. So I really want us to think about considerations here. Go ahead, Ramona.
So I find a lot of discomfort in negotiating or placating a failed proposal and trying to move forward a component of it simply because it's the only time that it talks about affordability at a moment where we have such a unhoused crisis in the city. So I guess my point of clarification would be getting the promise of providing a tax break to a developer in exchange for like 2 extra floors is absolutely ridiculous when we're talking about 60% AMI, which excludes more than half of our district.
I totally agree with you.
So I just want to put that out there as we
totally agree with you. But if in that case, we could put do not support and imagine something that we would like, right? So for example, I am not telling us we have to negotiate.
But the city's not trying to negotiate with us on this.
We don't know first of all, I'm very concerned this is not, I feel like it's going to die in discussion because so much is happening in city council. And
I'd be more worried about the mayor.
It's September. I don't know if this is going to get passed by December. And I think in January, everyone's going to be running for office. No one's going to want to discuss this. So all I am doing is I want us to be say something. If we envision anything, this is where we get as imaginary. And I would like to see, for me, for example, I'm speaking for myself, I'd like to see a mandatory, not optional, no less than 10% affordability. Westchester County does that. There's 8 million people in this city. We are a lucrative market for real estate developers because, honey, you ain't never gonna build enough for us, right? So you're never gonna build enough for us. So therefore, there's that never-ending saturation for building development. And I think we should have mandatory affordability that is 10%, anything above 10%. Now I hear you. What does that mean for affordability? I would say we go as low as we want.
But is it appropriate to put that as a condition for supporting something that is such a failure and a flawed
So for example,
proposal?
I'm going to tell you, here's the thing. There are parts of this proposal DCP knows is going to die. For example, parking. They already know there are parts of their proposal that will not see the light of day. So what we do, when we do topic by topic, I want us to see them as independent proposals. They're going to try to get as much as possible, but they do understand that the odds are against them for a lot of areas and a lot of places. So even though it is a city of yes, which is composed, just imagine it composed of multiple proposals versus one sole thing, which is why they really wanted people to use this document line by line.
50 things at us.
Yeah, couldn't it be under do not support as well, so we can have recommendations of why we would support.
Yeah, we can also give them comments on why we're not supporting.
Yes, that's
Okay,
right.
yes, but do we have the comments why we're not supporting?
So exactly how you just summed it up, that there is no 10% mandatory, so we're not supporting until that happens. Support from this borough or this area.
Okay, and when we say affordability, what type of? I see you, Emmanuel. I'm gonna get to you. Do we want to just throw in a percentage? We would like something like 30% AMI.
That's 32,000. Now you're leaving out 65%, right? This is why I'll just be quiet. I'll just vote the way I'm gonna vote, and I'll just say
Okay,
why I'm
Emmanuel,
voting that
you
way.
can go.
Yeah, I agree, and I will also like to add that I just worry about the existing housing stock. A lot of it is pre-war buildings. There's a track record of buildings collapsing in the Bronx in particular, and so I just worry about the instability that it's going to create. If it means even fortifying the existing housing stock, the displacement that would create for folks, even if it's temporarily.
So, okay, fortification of existing stuff does fall under Department of Buildings. and this is a city planning thing. Now, obviously, Department of Building must approve every development, and as the city gets into develop overload, then I hear you saying DOB is gonna be busy, and then our existing stock is gonna be overlooked, and then people will die. Or be displaced.
And they'll still be paying too much for rent
And be
as they die.
displaced. So I hear your concern, and I did tell DCP why are things running in silos, right? Like this is DCP, but DCP is like, well, DOB has to do stuff. What is DOB gonna do? We don't have that in front of us yet. So I do hear your concerns. So can we add that to reasons why we don't support, so we have a reason why, versus being silent? I really want to stop us being silent because we are overwhelmed with the chaos that is happening. Okay.
So you want us to take a vote?
15 minutes. Oh my God.
So you want us to take a vote and then state conditions?
Yes, I want us to take a vote and take conditions. Herman, I really, really, really need us to get out of here. I do. I know. I'm
You
sorry.
right, Herman. You right.
I'm sorry. I know.
Herman, you ain't never lied.
I know. All right, UAP, go ahead.
Delaney, how do you vote?
No, do not support. Do we have to put why? Is that a thing? Yes.
You said you wanted to put conditions.
Yeah, conditions like a minimum requirement of 10% mandatory affordability on average of 30% AMI.
So 30% AMI?
Yeah.
Got it. Ramona, how do you vote?
No.
Emmanuel, how do you vote?
No.
Whitney Williams, how do you vote?
Yes, with the same condition.
Okay, so lift costly parking mandates.
We can vote on that, right? Go ahead.
Sorry, I'm confused. She said yes on the same mandates, but you said no
she
on
said
the.
no.
Oh, yeah.
With an emphasis.
Yes, I do not support on the same mandates. That's what you meant.
Mm-hmm.
We don't pay attention. Okay.
Community code is good.
Okay.
Clear what I messaged.
Okay, we can go ahead and do lifting costing parking mandates right now. We can go ahead and do roll call on that right now.
Delaney, how do you vote?
Do not support.
Okay. Ramona, how do you vote?
Do not support.
Emmanuel, how do you vote?
I do not support it.
Whitney Williams, how do you vote? Okay.
Okay, now converting non-residential building to housing. Okay. Why you made that noise already? There is.
They want to do that more than 30 years ago. I'm gonna give you this.
Yep.
They came up to this problem and made post-more jobs sitting at me. They said they wanted to build on the waterfront. So Yankee Stadium all around the Hunts Point, something like close to 130,000 a park. They said affordable, and there's a female jumped up. Affordable for who?
Very
low income house that we're talking about. Anyway, the post was for 130,000 a park.
Okay.
From Yankee Stadium all the way up to Hunts Point along the waterfront.
And that's why every time.
Yes.
They did the same bamboos with the Second Avenue subway. I remember that over in the Host Road. I was sitting there early.
But this is the same reason why every time this comes up, we say that if you're going to start housing and it's supposed to be new development, it needs to be Section 9.
Okay, so let me explain to you a little bit before we go and vote on this, okay?
It's what we've been doing already.
I want you guys to know exactly what Ramona said. Said between 2010 and 2020, we've already been converting space. We've taken 7 million square foot of office space and have only converted 7 million square foot to 4,300 units. That's how much. Converting office space is really hard, you guys, because think about it. There's one bathroom for how many people on each floor, you know? So gas lines, it's a bit complicated. However, I work in downtown Manhattan. There's a lot of empty offices. Yeah, there's a lot of empty offices. And because the offices have been empty, we've lost a lot of small businesses around there that fed working people. And people don't want to go back to the office. I got to be honest with you guys about that. So, again, remember I said the only thing that talks about affordability is the last thing we voted on. So,
we can take a vote.
Anytime we vote, if you want to make it affordable, in the name of Jesus, please do so. Call a vote.
Delaney, how do you vote?
I support it with the caveat that 20% of the conversion should be affordable units.
Ramona, how do you vote?
So I do not support, and I want to reiterate the condition that I set to the city when they came into the presentation. If those new conversions are not Section 9 public housing, they will not be affordable to the district in which they're being developed, because Midtown and Downtown's AMI is even higher than ours, right?
No, it's one city, one AMI.
I mean, so that, but the AMI for down there is gonna make it even harder for
It's one city,
people.
one AMI.
The AMI outside of Section 9
Oh, absolutely.
is gonna make it difficult for working class New Yorkers and unhoused individuals that are transitioning, which is what they want to talk about, right? So underused non-residential buildings, not my problem. My problem is housing my community. So do not support. And if the city wants to have a conversation with CB1, I would say that they need to be bringing us an opportunity to make these places public housing.
Got it. Emmanuel, how do you vote?
Do not support.
Whitney Williams, how do you vote?
Can I vote yes with the condition that they're Section 9 housing?
I see you shining.
Okay, woo, we're moving on.
I see the glow.
It's split. That's it. That's what we present to the board. We gotta get the hell out of here.
That's why I just build up the project.
But this is all we have to vote on before it goes to general? What about the rest of the stuff?
No, we gotta vote on that too. I'm just saying, but we're yeah. Okay, so hold on. Where are we?
I think we need to do like rapid for the rest.
Okay, rapid for the rest. Okay, small and
shared housing.
Small and shared housing. I just want to say that they believe that if we build more micro units, people will move out of big spaces.
Let's take a vote.
What a lie.
Learning.
Learning, how do you vote?
Do not support.
Do not support.
Emmanuel? Okay.
Campus infill.
There's so many.
Campus infill. Make it easier to add.
I just want to. That was a tough one, but I do want to say, under Eric Adams, we have built the most affordable units have been studios and one bedrooms, which to me is a direct attack on large families. And I do want to give you an example. NYCHA never moves. They don't like to be resized. So people don't like to be resized. They like their spaces. So campus infill.
It is not the city's job to give people a college experience. People deserve to live in full units and not to live in tenement style housing.
Okay,
in the greatest city in the world.
Campus infills. You guys want to talk about it? We're just going straight.
Let's just go through the vote.
All right, campus infills.
Learning, how do you vote?
I put do not support, but on the condition that anything built on NYCHA property, anything built on NYCHA property,
be NYCHA,
falls under NYCHA income.
Section 9.
Yeah, Section 9
specifically.
But I do want to say,
go there, Avenue.
Emmanuel.
Okay. Go ahead, Emmanuel. What, Ramona? What's your vote?
I said no. No, with the same condition.
Emmanuel, you said no. Whitney Williams, how do you vote?
I do want to add that.
No.
We have to always be like green space is important because Whitney told us that if you take away too much green space, it increases crime.
I agree, but let's not keep discussing that. New zoning districts.
Ooh, child,
Create new residence
really
districts
confusing
requiring mandatory inclusionary housing that can be mapped in central areas in compliance with state requirements.
I don't understand.
New zoning districts.
We already did a whole zoning.
Go to that one, to number, whatever that is.
Hold on,
after campus infill.
You guys, they were showing you guys how much houses they were going to build on the campus.
Yeah,
infill.
that's Fulton and Chelsea right there.
Where are we? No, E10?
Mandatory.
New zoning districts.
Yeah.
I didn't understand what they wanted us to do with that.
So new zoning districts include blah, 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 blah.
Oh yes, it's still going to require ULURP. So then I was like, we're okay.
Are we though?
I mean, we have a ULURP. We're about to vote down, I think. So I feel like that gives us a voice.
So it's basically, this is the killer for me, right? Where it says just makes the districts, but does not place them on the zoning map.
Well,
with the
because we have to
recent
vote
change
on it,
in
you
multiple
guys.
dwelling law, like, nah, let's just.
All right, let's call a vote, you guys. Let's call a
Learning,
vote.
how do you vote?
I support.
Ramona, how do you vote?
Do not.
Emmanuel, how do you vote?
Oh, I'm moving it. Sorry.
Yeah, right there. Because the killer is like, you're basically gonna hide them from existence, and then if it has to go on the map, you want them to go through the ULURP. So you're basically bypassing the ULURP process.
I don't want
if you allow this.
Oh, this is so hard.
Or am I bugging? Because look how it says. It's basically including new zoning districts, which will be added to a zoning resolution, but will not yet be placed on the zoning map. So any attempt to add them to the zoning map in the future will require a ULURP action.
Right, so then how does it bypass ULURP if it requires a ULURP action?
Because it's only going to require ULURP to put them on the map, but not to actually zone it. So he's going to get to zone differently without going through the ULURP is basically what they're trying to do.
Because we sometimes vote on rezoning.
That's the problem.
So this will mean that we don't get to vote on rezoning.
He can do
anymore.
whatever the hell he wants. And then when we're like, oh no, but let's put it on the map, then he's like, oh yeah, now you can go through a ULURP process.
You know what? ULURP training is not on the community board, and that needs to be done because I'm in it and I'm at the same time. All right, call. I need to vote again.
What she said?
I need to change my vote.
ULURP is like the community. It's like the city process.
I do not support.
Ramona?
Hell no.
Emmanuel, how do you vote?
For zoning?
Yeah,
Whitney
there's like a
Williams,
whole
how do you
process
vote?
that comes to the community board.
Okay.
So like Close Rikers had a whole ULURP process.
Yeah. Okay. Now,
So he's gonna
update
delete
mandatory
everything like it doesn't
inclusion.
happen.
We already have this, you guys. Okay, it is already in our thing. Mandatory inclusion. This is very strange because if parts of it doesn't pass, I don't know how they're really going to update this. But this is already in existence, and it just slightly enlarges the floor area ratio, which just means that there's more area for affordable housing.
It just kind of like sinks the city's process.
Sinks.
So it's more like a sinking process.
Yeah,
for
and
the
it helps
city.
us a little bit, right? Just helps us. I mean, I don't know what point.
I'll give them this one.
Okay, ready? Vote.
Learning, how do you vote?
Support.
Ramona?
Support.
Emmanuel?
It's like paperwork, basically. But I love you for it though. I live for that.
Whitney Williams, how do you vote?
All right, silver law. This one I want you guys to. I'm so upset about this. This is the biggest scam ever. So, you guys just know in 2016, Bill de Blasio, under a different DCP director, introduced this, which is just waiving the silver law. It's just like it's the little houses on the corner, little buildings on the corner that are like angled a little bit, but it's so one building's not taller than the building next to it. Okay, but de Blasio was going to waive this if it was affordable units. Okay. If it was going to be affordable, they were allowing exemptions to silver law. Under Eric, he said it's for free. It's for free. It's for free. You forget this law, no affordability requirement at all, and that makes me so mad. That makes me so
So
mad.
it limits buildings less than 45 feet wide to the width of the street.
Yeah, because there's some like
unless
angle-
they're next to a big building.
Yeah, we don't really have them here, but if you're like in like Flatiron, they got some over there. Some of them on the Upper East Side has them. We don't really have them, but yeah, in 2050, under Director Carl Weisbrod, the exemption to the silver law was only permissible to provide affordable housing. ZR 23692.
Yeah.
Given it would change the streetscape of the block, causing the new building to tower over the small building. However,
So this will force Upper East Side and like all these people that don't take burden to take on more burden.
And they didn't want to even with the affordable units. Now they got to take on burden just for
Without
market rates,
All right.
market rate units. So I just it's a ready
All right.
call to vote. That's my summary.
The learning.
No.
Ramona, how do you vote?
I was actually gonna support it just to screw the Upper East Side.
God, it's provide affordability.
Just for karma, for the ancestors.
Yeah. So what are you voting down?
Emmanuel? No, I'll support it.
Okay.
Yeah, just
how
to
do you
fuck with
vote?
them. And you do have a point about the triangle and the hub, Emmanuel.
Oh.
That sliver.
Yeah, that's the sliver. Yeah.
Yeah.
You're right. The hub does have this fall.
Like Chase Manhattan Bank on 138th.
Yeah, that's
This is why Diana stopped the building from being taller. It
Okay,
was,
so
it was the
it's
sliver.
not now you're screwing us. You
No, but they already built it. They can't do more on top of it.
Oh, okay.
So we're not going to be affected by it anywhere else.
But in the
So,
future,
in the future,
go ahead, Emmanuel. Come on. Y'all, I gotta go.
just go with the gut, yo.
No pressure.
Go with the gut, and then I'll bully you.
We're almost done, right? This is just it.
I'm gonna say not in favor.
Do not support. Okay.
Whitney Williams, how do you vote?
Okay. Okay, we can put emphasis affordability requirement.
Yeah.
Emphasis affordability requirement and put C 2015.
See 2015.
Okay.
So we're doing 20.
All right.
Yes,
Quality housing amenity changes.
Alrighty. Okay, we made it, you guys.
Yeah.
I don't have, let me see if I have notes on this. I don't
So
really know
extend
what's
amenity benefits in the quality housing program to all multi-family buildings and update to improve these incentives for family-sized apartments, trash storage and disposal, indoor recreational space, and shared facilities like laundry, mailrooms, and office space. So extend quality housing program benefits to the entirety of a development?
I don't know, you guys. I think this is when they told me I didn't have to vote at the borough board and I stopped reading.
Let me see the recommendations or
Oh, the
the
consideration?
considerations. Quality housing has a quick program.
How is program better for building for tenants? Because if you don't have laundry in your building at this point, it's really like a struggle.
Yeah.
Yeah. I say, okay, we're ready. Call.
Yeah.
Learning, how do you vote?
Support.
Ramona, how do you vote?
Support.
Emmanuel, how do you vote?
Support.
Whitney Williams, how do you vote?
Support, but is there a way to like ensure where prices don't drastically?
Woo-wee. Good question.
That's why she's on the board, yeah.
That's what she gets.
And
Okay.
ECR is gonna.
Yeah, and I think the units might be a little bit smaller because they putting all this stuff for you.
That's a good point. All right, so land track,
So what am I
landmark,
putting- what consideration I'm putting for you?
With
like no burden on tenant.
I don't think that's possible. I don't think.
Yeah, that's.
Yeah, that's like
That's what I want.
Like cap rent increases by 10%.
Oh yeah, so we could do like rent
Ah.
control. There should be like rent control units because we haven't even. They talking about affordability. We haven't talked about rent control.
Espérate, so the point that you just brought up makes me think of like when the landlords take an apartment and then remodel it
Yeah.
and then kick it up.
Because what is
So what's
quality
the
housing?
program that allows for landlords to,
MCI, future capital improvements.
So should be cautioned, like they should be cautious
But that would be.
to ensure that MCIS
MCI.
history of failing renters is not repeated within this
Because if it's but if
this
it,
space.
but if it falls under if it's rent control, then it'll fall under DHCR. Okay, Department of. Tell me what the H is.
Department of Housing Community.
Yeah, so we would want to make sure. I don't know if anyone's talking about how units end up there, but we need more units to be in there under that.
Oh, and rent
agency.
control?
Yeah.
But I think for now, what Whitney's comment is hinting at is the danger of landlords claiming that they've made improvements
And now quality.
and
housing.
therefore can displace existing tenants because now it's quality housing, right? And then MCIS is the model that's causing that issue.
Okay, no, I'm looking at you for clarification just to make sure.
I'm trying to like
We're
paraphrase.
gonna get the notes. Once you get the minutes, I'm gonna like try to type this up in preparation for the 26th.
So landmark transferable development.
Okay, let me. Okay,
Yeah, just go to like
consideration. Okay.
her suggestion or whatever that was. Talking about we ain't experts. Come at me, bro. It would make floor area transfers unlimited in high density districts. Arguments against it include minimum CPC special permit. Arguments
I don't like anything that removes CPC special permits or ULA. Nothing. I hate anything that removes that. I really do.
There's just a lot of this thing does not require.
Yeah.
No, because they really don't. I really want damage.
And then receive cash or other benefits to support their landmark.
Okay, so we ready? Yeah, ready?
Go down to the considerations for it.
This is all considerations. That's how long consideration is.
Jesus Christ.
They're so long, but all I heard is remove CPC special permits, remove ULERP, remove actions that involve city council. It's a no for me. Let's go. Call the vote.
No.
The learning.
No, do not support.
Ramona, how do you
No.
vote? Emmanuel, how do you vote? Whitney Williams, how do you vote?
All right, you guys, this is the last one.
Railroad.
Railroad.
This does affect us.
Oh, what is that?
149th.
Oh.
They've been wanting to, and Hunts Point, they've been wanting to cover the tracks with housing and development. So this going up to the post office, Herman. You know where you see Metro North and Amtrak?
Okay, we're so close, you guys.
All right, so
close.
railroad
So
right of
close.
way. This proposal defines the term, blah, blah, blah. Railroad or transit airspace. The proposal reduces the required approval for building over. Wow. It's ambitious.
But it removes city council.
Nah. The railroad right away. Proposed for CPC.
I mean, we can't be the last line of protection.
Hell no.
We're not equipped enough to be the last
no.
line of protection. We are not equipped enough. So, guys, ready? Let's call.
Yeah.
No, do not support.
Ramona,
No.
Emmanuel? No. Whitney?
Okay, you guys, we made it. Oh, wait, there's some other stuff I got to tell y'all. Oh, no, we did it. We did all business. So, can I get a motion? Wait, first of all, I need to make a motion that the positions we took on the City of Yes opportunities are adopted as the board's reflection.
So like the official recommendation to the
official
board?
recommendation. This is, okay, can someone make a motion? I can't make the motion, right? Isn't it that? I cannot make the motion. Someone make a motion.
I'm motion. Oh, Whitney motion.
I, Whitney Williams, move that this roll call be taken as a formal committee recommendation to go to the full board for approval.
I'll second that.
Ayes? All in favor?
Yeah.
Wait, is there a discussion on it? All in favor?
Look, even Herman is pleased.
Aye. Anybody abstain? Any opposition? Okay, that is, motion carries. So you guys, nobody got anything else to say? Nothing? Okay. Can somebody make a motion to adjourn this thing?
Oh, wait, you said that you wanted to tell us about the tour you had.
No? Oh,
well, you can hold it.
Yes, we can hold it.
Or send it in an email.
Okay. Yes, okay. I'll tell you guys about the tour later. But go ahead, it's been a long day for Leo and I. Let's go.
So adjourn?
Yes, make a motion to adjourn.
I, Emmanuel, make a motion to adjourn the meeting.
Yeah.
Can I get 1 second?
I'll second it. You can second it. Yeah, get on the record. You've been real quiet today.
Silently. Hi, Christine, second that motion.
Okay, any all in favor?
Aye.
Okay, the meeting's adjourned. You guys, you did so good today. So good. We talked about
Killing
so many
dreams
things.
left and right.
So good. I'm so proud of us. I'm so proud of us.
That's what I call a meeting.
Okay? We got so much
Look
work
at that.
done.
8:07.
Steven, save all of these for our next monthly meeting. Just in case people come and they haven't heard it.
Got it. We're good.